Hey everyone, and welcome. Today, we're going to dive into a topic that touches so many families, cerebral palsy. Now, I know it can sound really complex, maybe even a little overwhelming, but our goal here is simple. We're going to break it all down, make it clear, and hopefully make it feel a lot less intimidating. So let's get started. I want to start with a really simple but powerful analogy. Picture the brain as a computer and all the muscles in the body as the keyboard. With cerebral palsy, the keyboard itself, the muscles, are usually just fine. The real issue is in the wiring, the connection from the computer to the keyboard. And that idea is so important for understanding everything else we're about to cover. And this is exactly why this conversation matters so much. Roughly 1 in every 500 children is born with cerebral palsy. That makes it way more common than a lot of us might think. All right, so let's get right into the fundamentals. What is cerebral palsy exactly? Well, at its very core, it's known as the most common motor disability that starts in childhood. Okay, here's the more official definition. And the words to really focus on here are group of conditions. Why? Because CP can look very different from one person to the next. But the common thread is that it affects movement, balance, and posture. And it all stems from damage to the brain while it's still developing. Okay, this next slide is huge because it tackles some of the biggest fears right off the bat. First things first, CP is not contagious. You can't catch up. Second, and this is a massive point of relief for families, the original brain injury doesn't get worse over time. It's what they call non-progressive. It's also absolutely crucial to know that CP affects movement, but it does not necessarily affect a person's intelligence. And finally, and this is the most hopeful point of all, getting help and support early on can make a world of difference. So that naturally leads us to the next big question. How do you even know? How is cerebral palsy actually identified? This is all about picking up on the early signs and starting that journey to get some real answers. For any new parent or caregiver, these are some of the key things to look out for. And what's tricky is that it can show up in completely opposite ways. For instance, a baby might feel really floppy, what they call low muscle tone, or they could be the exact opposite, feeling very stiff and rigid. You might also see delays in big milestones, like rolling over or sitting up, or maybe they really seem to favor one side of their body over the other. So if a parent has these concerns, what does the journey to getting answers actually look like? Well, it's not just a single test. It's really a careful process. Doctors will go over medical history, they'll check on all those developmental milestones, they'll do a neurological exam to look at reflexes and muscle tone, and often they'll use brain scans, like an MRI, to actually see the brain's structure and confirm what's going on. All right, once a diagnosis is made, doctors usually classify CP into different types. This is all based on the specific kind of movement challenges a person has. Let's take a look at the 4 main ones. This chart really puts it into perspective, doesn't it? You can see right away that the vast majority of cases, we're talking 70%, fall into that one big category, spastic CP. The others are less common, but they're just as important to understand. So what exactly is spastic CP, that big 70% chunk? The best way to think about it is like a rubber band that's been stretched way too tight. That's kind of what the muscles feel like, stiff, tight. This can cause movements to be jerky or difficult, and it can affect just one arm or sometimes the whole body. Okay, next up we have dyskinetic CP. The keyword here is uncontrolled. This type is all about involuntary movements that a person can't really control. They might be slow and twisting or sometimes fast and jerky. It can make something as simple as holding a pencil or a cup really challenging. Then there's Ataxic CP. It's the least common type, and it's all about balance and coordination. This is because it affects a part of the brain called the cerebellum, which is basically our body's balance center. This often looks like an unsteady, shaky walk and makes tasks that need a lot of precision pretty tough. And last but not least, you've got mixed CP. And, it's exactly what it sounds like. It's when a person has symptoms from more than one of the types we just talked about. The most common mix is spastic and dyskinetic, which means someone might have stiff muscles and those uncontrolled movements. As you can imagine, this requires a very tailored and flexible plan for care. Okay, now we get to what is probably the most important and honestly the most hopeful part of this whole conversation, treatment. Now, there isn't a cure for CP, and this is a huge but. There is an entire world of therapies and support systems designed to help people thrive. You can think of these as the core 4 therapies that really form the foundation of care. You have physiotherapy to build strength, occupational therapy to master daily life skills, and speech therapy for communication. And on top of that, there are medications that can help manage some of the specific symptoms, like muscle tightness. But that's the established foundation. What's on the cutting edge? What are the new advances that are really giving families a new sense of hope? Well, one of the biggest areas of research right now is stem cell therapy. The whole idea here is pretty mind-blowing, actually. It involves using the body's own master repair cells to try and regenerate and heal the damaged parts of the brain that cause the symptoms in the first place. So, how well does it work? Well, the early results are just wow. Some studies are reporting success rates of around 85% in showing real, measurable improvements in things like motor skills and speech. Now, it's definitely still an evolving field, but this is a huge leap forward. And all of this, the diagnosis, the understanding, the treatment, it all points to one goal, which is what our final section is all about: living a full, happy, and independent life. You know, technology and clever assistive devices are just complete game changers. I mean, from walkers and wheelchairs that provide mobility to amazing high-tech apps that can give a voice to someone who can't speak. All of these tools are designed to do one thing: break down barriers and create independence. So this really brings us to the biggest question of all, the one that's on every parent's mind when they first hear this diagnosis. And the answer, thankfully, is a clear, resounding absolutely. With the right support, the right therapies, and a community that believes in them, people with cerebral palsy can and do lead incredibly full, independent, and happy lives. So let's leave it with this final thought. We've seen all the different therapies, the amazing technologies, and the incredible potential that exists. The real question for all of us now is, how do we make sure that every single child has access to these tools so they have every possible chance to build their own amazing, unique, and fulfilling life? Thanks for tuning in.